Testing, 1, 2, 3.
Are we signing paychecks? Do we get paychecks for this?
Yeah, what?
Ask your boss. I heard that.
I think you're all my bosses, right? Anyway.
We meet again, Bob.
Hey guys, how are you? How big is my head on the screen over there?
Oh, it's life size.
Oh, great.
I'm going to call to order the Town of Groton Town Council Public Safety Committee meeting. It is 4:39. In attendance are Councilor Roscoe Merritt, Councilor Adam Pacino, Mayor Jill Rusk. In addition, we also have Robert Dermott, from Groton Ambulance. John Burt is here. Todd O'Donnell, thank you, from Mystic River Ambulance. I should just glasses in the beginning. Jonathan Wilson from Mystic River Ambulance. Maria Wilson from Mystic River Ambulance. Chet Nicky from Groton Ambulance Association, and Bob Holdsworth from
The Holdsworth Group.
Holdsworth Group.
Yes.
Thank you.
Yep. You're welcome.
Thank you all for being here. Does anyone have any communications?
No.
The first order of business is approval of the July 16th special meeting minutes. Any motion? Any corrections? Okay. All in favor? Passes.
One note that this does not do a great job, even if they can hear on Zoom, it doesn't always record great, so speak up, pretty loud. So.
Okay, so that passes 3-0 to 0, passing the minutes. The only thing on our agenda today is a referral for Groton Ambulance Service funding to make a formula referral. Do you want to, one of you want to read the background? Please.
Reference to item 2024-598 ambulance service formula referral. Background is town council provides funds routinely to Groton Ambulance for its annual budget process. Town council will discuss whether to make a referral to the town's public safety committee to discuss a standardized way of help guide funding decisions. On June 25th, 2024, the town committee of the whole referred to the item town council public safety.
So really the background on this is that every year we're kind of questioning what the budget's going to be. Is it going to go in a small amount? We want to make sure that we're fair and equitable to everyone on how we do this. For the past few years, budgets have been fairly consistent with the exception of 2020. Was I think a little bit 2020, 2021. Those were the COVID years and a little bit off. So we I spoke with Nikki beforehand, and apparently Mr. Holdsworth has a proposition for some some information that you would like to share?
So I was contacted by the mayor during last budget series, and he said there has to be a better way for us to do this. So we took it back. At the time, it was Michael Gilman from Mystic River. He was told the same thing. We aren't in the business to be able to predict what's going to happen in 3, 5, 7 years. So our board decided to retain Bob Holdsworth, who has been doing this 50 years, maybe?
Thanks for that. 45 will be fine. Thank you.
I stand corrected, 45 years, so he's a little bit of a newbie. But given his vast knowledge, we felt it would be better for our organization to, for lack of a better term, bring in a professional. We handle all of our day-to-day operations, but we are in our own little bubble. We are in Groton. We know what's going on with Groton. Bob luckily has the experience to know what's going on statewide, what's going on nationwide. And he actually started out at Groton Ambulance as a volunteer. He came back to us as a per diem and was able to ride his sons were EMTs, and he was actually able to ride both of their first shifts as EMTs. So it has kind of come full circle. For a man that really needs no introduction, anybody that's been in the service for any amount of time knows who Bob Holdsworth is. And we met with Mystic River and Bob Holdsworth this afternoon, and we have a concept to present to you. We don't have any hard and fast figures. This is just to present the concept and kind of explain the backstory of where it came from and allow you to have the expert here to ask any questions that you may have.
Just to give a little background before we get started on that, I don't know that everybody knows that the ambulances are not funded directly through taxpayer dollars. Groton Ambulance is not a part of the town of Groton budget specifically. Mystic River is not specifically in the Stonington and Groton budgets. They basically come every year to ask for funding to help offset their costs. So you get funding through insurance and through municipalities, correct? And donations.
We only get funding from, we bill our patients, and we get subsidized by the town of Groton on a yearly basis to what I present my budget to the town manager, and then that whole process begins. I think the intent was to come up with some formula so that every year we weren't doing the same exact thing, almost streamlining it. But we, as Mystic River, we get various payments through Medicare, Medicaid, private insurance, self-pay, or no pay. So we do have calls that we can't bill for, that we still provide a service, and we still have our ambulances and our personnel at the ready. And that's one of the main reasons why we asked the town for subsidy. Again, Bob can go into this a lot more detail and a lot better explanation than I can.
I can
I
do
think-
that. I'm sorry, Councilor Rose.
I think you are up. I think you're on.
Sounds good. Just for background purposes, because I haven't met everybody in the room, most of the people on the ambulance side we've met before. And disclosure, I was the billing agent for both Mystic River and for Groton for years until about 2017. So I understand both agencies fairly well. And I was the original director of the paramedic program at Lawrence Memorial. So I was EMS coordinator over there prior to Ron Kersey's involvement, and now there's other people, Tim Law is involved. So my background goes back through commercial ambulance up in Hartford, obviously the work at L&M, and my consultancy is about 36 years old, and I've worked with clients all over the country, and also some international clients in the ambulance business. That's all we do is EMS. So that's the expertise that I bring to the table. When Chet and his board approached, they said that you guys were looking for a formula to try and streamline the funding, which is what I just heard as well. And there's really, just for knowledge basis, there's really only a couple of ways to fund an ambulance service. The most common is, of course, billing revenue, where ambulance services charge. And the interesting part is that the state of Connecticut sets what we refer to as the retail rate or the common rate. And then Medicare, Medicaid, and the insurances set their own rates, all of them less than the common rate that the ambulance service has to rely on. So the ambulance service has to be there 24 hours a day, respond to calls, and when they put a patient on their stretcher, most of the time they do not know what they're going to be paid for that trip until after the trip is completed. It's a funky business model, but it's just kind of the healthcare model that we have. Medicare and Medicaid both pay about 40 cents on the dollar, and some or most of it, that's the difference in 60%, is not collectible. It's called contractual allowances. The ambulance services have to write them off. So you're going to hear me go through a couple of terms that if you understand them already and know them, please stop me, but I just want to make sure everybody's kind of on the same level playing field of knowledge about how the ambulance industry works and how it's funded. So the important part for you as the Public Safety Committee to know is that there's a payer mix, and that is the mix of patients and who's paying the bill on their behalf by insurance. And I can tell you from knowledge of working with both organizations, the demographics in the Mystic area and the Groton area are different. The volumes are different. The expenses are different. Their business models are different. So coming up with a formula for kind of a one-size-fits-all, I'm going to give you a concept in a few minutes that I think is as close as we're going to get. There may be other options that you want to consider, but I think this might be the best to work to solve the issue with the two different providers that you have. So to go back a little bit, and please stop me anywhere along the way if there's questions or you want to clarify something. The common way to fund an ambulance service is what we call fee for service, which is what I just discussed with you. The other is tax subsidy or taxing district, which is not a realistic scenario here. In the state of Connecticut, it's almost impossible to start a new taxing district at this point. Then there is obviously donations, which are dwindling for anybody who's trying to collect them, and costs are escalating. So that's kind of a non-starter, but it's an ancillary source of revenue. And then there's tax dollars. So if it's not a taxing district, like the fire districts where there is an actual tax for it, then it comes out of taxpayer dollars as a subsidy for what is a state mandated service. It's a necessary service. Connecticut's one of, I think, 18 states that has deemed EMS as an essential service. Although a lot of contracts and a lot of municipal budgets don't reflect that as of yet, but they do have a line item for ambulance funding. So when we look at trying to create a formula, we take the budget for the ambulance service, and my suggestion for all of you this year is, as we go into the 24-25 budget system and cycle, let's look at both budgets and let's make sure that we are comfortable with those numbers, both from the ambulance side presenting to you, and you as the Public Safety Committee charged with making sure that you're not paying more than you should for services. So when you look at the budget, is the budget reasonable? Do you understand it? Can you go back to your constituents and say, yes, we understand what they're doing, how they're doing it, why they're doing it. And then you have solid ground to stand on when you're putting forth this is the subsidy that each agency should get in order to operate at the level we want them to operate. So when we do that, the budget the way that we look at it is we take the budget that's been endorsed, and we can start with this year, and then we can assume a cost of living increase each year. So we could kind of project out 3 to 5 years of what that would look like, barring any unforeseen things, like a pandemic or something that might pop up. So we take the whole budget that we've agreed on, we divide that by the number of responses the ambulance service is required to answer. So in Groton's case, Groton answers almost 6,000, between 5,500 and 6,000 responses a year. That's 911 requests for service that must be answered. Mystic River, based on what Todd told me this afternoon, in the Groton service area, that's about another 1,400.
I interject just 1 second? I'm sorry, I missed that. You said Groton's number of responses a year were 900?
No, 5,500 to 6,000.
Thank you,
You said 911 calls for service.
thank you. I
That's
knew I
what
was
it
off. So 55,
To 6,000 calls per year.
Right.
Yeah.
And Mystic River does 1,400
On the
to
ground
the
side.
Groton side of their PSA.
So the system that you're funding / subsidizing, and really it's subsidizing because there's revenue that's there, but there's a shortfall, as there is almost everywhere. You're looking at trying to make sure there's an ambulance available for almost 8,000 requests for service every year for Groton residents between the two districts. The ambulance industry, as I said earlier, only gets paid for the transports, and they don't know how they're getting paid until after they've done the transport most of the time. So while you respond and it's called cost of readiness in the business. You have to have costs associated with having the ambulance available to respond 24 hours a day to those roughly 8,000 requests each year. The ambulance industry only gets paid on the patients that are transported. There are some programs for treat and release, treat and a patient refuses. Not every insurance company pays for that, and they pay for it at an extremely discounted rate, those that do. So we really don't count that revenue yet because that program's not mature enough to count on. It's there, but it's not good yet. So you have to have a budget that covers the 8,000 calls. You have to have a budget that also is going to operate based on the revenue that comes in, which in this case, I haven't done Mystics yet, but Groton is responding to calls, and about 16 to 17% of those calls are what we call dry runs, meaning the ambulance goes and expends expenses to get there and staff it and evaluate the call, but the patient ends up not going. So that could be a fire standby, a police standby, that could be a motor vehicle accident called in as one thing, and the patients are not hurt and don't want to go to the hospital. It's a refusal. The ambulance company still expends resources, but there's no revenue to be recovered from those calls. As I stated, the revenue that does come in when it's Medicare and Medicaid, those are significantly discounted payments. And in Groton's case, that accounts for just under 70% of the patients that are transported. So they are getting paid at a discount on the calls that they actually transport, and it's almost 70% of their volume. And there's nothing that they can do to improve that reimbursement. And when we come back to you with, if this formula seems acceptable to you, that I'll present in a minute, we'll also come back to you and show you what those rates are, so you understand concretely what the retail rate is, what the discounted Medicare and Medicaid and TRICARE, which is the military insurance, which pays the same price as Medicare, basically. So you'll actually see those numbers, and it will shock you the amount of discount that's taken. And the ambulances have to take it. It's mandated by statute, so they don't have a choice. So when we look at this, we say, okay, we have to figure out what the cost per call is or cost per response. So that's the budget divided by the number of runs. Then we have to figure out how much it costs us to transport a patient. So that's the budget divided by the number of transports. And then we have the billing revenue divided by the number of transports equals the revenue that we get for each call. And when you take the revenue that's recovered from the budget that's required to be there for those 8,000 calls, you end up with a shortfall in most cases. It is rare the agency that can generate enough revenue from billing to hold, to cover all of their expenses at this point. So what we would like to come back to you with is a quantifiable number for the last couple of years, showing you the responses, showing you the transports, showing you the budget for 24-25. And we will take out from that budget the 300,000, forgotten at least 300,000 that you've been putting in, to show you what that number would look like without the subsidy, and then see what the subsidy needs to be going forward. So we can all agree on that. Does that make sense to all of you?
Also good.
Can I get one number before we move too far forward?
Sure.
What percentage is your Groton versus your Connecticut?
About half.
Thank you.
So,
Have an idea of where we're at.
and the other thing that, as a public safety committee, it's important, I think that you need to know, is that Groton and Mystic are completely different. They have completely different organizational structures, numbers of volunteers, numbers of paid staff. Insurance costs are dramatically different between the two, since Groton is predominantly a paid service with some volunteers, and Mystic is predominantly a volunteer service with some paid folks. So the insurances are extremely different. The fleet sizes are different. And that's why it's very difficult to do any other type of formulaic approach to this, so that the council can deal with one formula, apply it to both services. I think getting the way I explained it to you, cost per response, cost per transport, revenue per transport, and then showing you the difference in order to make the ambulance services whole, I think is the best approach of any of them that are out there. If we try to do it any other way, you're going to end up with two separate formulas because of the disparity between the two organizational structures. Both of them good, nothing wrong with either one of them. But just, it is what it is. And that's kind of, there's not really a one size that's going to fit all perfectly because of that. Does that make sense?
Just to clarify, you said your three formulas were budgets divided by number of runs, budget divided by number of transports, and then budgets divided by revenue.
Revenue divided by transports. Yeah. And I think the other part of that formula from the public safety committee's perspective is the ambulance service will still share its budget with you. It will still share its call volume, its transport volume, and its billing revenue. So there's transparency built into that approach that you should be able to feel comfortable standing on when you go forth to the full council and say, this is the subsidy that's needed. We've looked at their budget. We've looked at, and it doesn't need to be, significant negotiations. It can be a fairly quick presentation, and it doesn't have to be more than 15 to 20 minutes. If the formula is there, we plug the numbers in and ask some questions, especially if there's a change going forward that would need a larger subsidy for some reason. But I think we can project out fairly well for 3 to 5 years what the number will be without a dramatic change, to the point where we could probably even have an operating agreement that identifies what the ambulance service will do, what the town will do, and what the costs might be going forward for, like say, for 3 to 5 years. The big things that are going to play into the ambulance industry in the next 18 months Some of the programs that are not quite mature for reimbursement of refusals and things may get more robust. They also may go away. So we don't know that yet. The other is we don't know how the national election is going to go, because the national election will in fact drive Health and Human Services policy going forward about what will be paid for at what rate. So until we know who's at the helm of those agencies, don't know what their priorities will be, and what they are likely to provide in the way of subsidization and support for the EMS industry. The best thing that could happen is whoever wins sees the value of emergency services, emergency medical services, and there's some federal dollars that flow into the system in the form of either Medicare reimbursement at a higher rate, or more things covered. There's talk about patients being treated in their home and being covered. So transport won't be necessary, but some revenue will be there. Those programs are on the drawing board. They could go forward, they could die, they could be modified, and we just don't know at this stage of the game. But I think we are comfortable enough with the transparency of where the budget is, if we work diligently one more time on the 24-25 budget as a starting point, and make sure we have everything in there that needs to be covered to go forward with capital improvement, making sure that the equipment is up to date. Ambulances are in queue. Right now, it takes you 18 to 24 months to get a new ambulance. If you ordered it today, I have a client that just ordered 5 of them 4 months ago. They were told, see you in 2 years. So we need to plan for those purchases now. We actually may even need to get into the queue with those purchase orders placed as placeholders, knowing that you have the ability to walk away from them, because every one of the ambulance manufacturers, they're non-binding. They hold the place in line, get the truck in line. Final price will change. And you also have the ability not to take delivery if you wish. But if you're not in queue, you're just falling further and further behind the 8 ball. So I think both organizations need to look at what they need for capital replacement, vehicle replacement, and make sure that that's properly accounted for in any budget that we deal with. Make sure there's a fund for that. I know Groton has one. I haven't seen this year's numbers to see if it's where we need to be based on fleet age yet. But I think my hope is that doing this one more time, whether it's just with you folks in the room or with everybody in the larger meetings that we've all attended, making sure we are on solid ground to start with. I think the formula after that will kick in, barring any notable exceptions.
So do we have any actual numbers? Yeah, what this looks like?
We don't, because
I couldn't hear the question, guys.
I'm sorry. The question was, do we have actual numbers to plug in here? So that we have what this looks like.
About a week to 10 days, we will have them.
Okay, sounds good.
Yep.
we want to bring the concept to your group first. Get the okay to proceed further and
Are we
get
going in the
more
right direction?
information to, like, this was just a proof of concept.
Questions?
Does it work for both your organizations?
What,
Concept.
Within parameters, yes. Different models. They have different, subsidies, different things that are provided by the town than we do. Things like that. To balance all that out.
Sounds fine to me.
Talk to me a little bit more about.
Town provides the bill. Town provides you landscape.
No. No, they don't plow. I spend a lot of money on
So
landscaping.
it's just
plow.
bill.
So the town
And
owns their building, you
we
own your
mortgage.
building, you have a mortgage. Okay.
It still play into the overall cost, though. It would still just play to the overall cost, though, yeah.
Your overall budget.
Yeah, it's not much.
the single largest portion, if I'm not mistaken, both of our budget, the largest portion of both of our budget, our salary. The significant difference in our business model makes that portion alone very. There's mostly paid staff. Ours.
We pay the staff 20%,
Yes.
whereas we're paid staff. Well,
There's there's a bunch of differences between Groton Ambulance and Mystic River. I just want to make sure everybody understands that when they call 911, regardless of what ambulance shows up, they are getting
the treatment is
trained.
going to be the same.
The treatment is the same.
Mhm.
So it's just how we get there is the different business models. One of the big things for us included in our employees is health insurance costs. We pay for our own health insurance through our own broker. Mystic River full-time employees are covered under the town policy. So when I go to Anthem Blue Cross,
Yeah.
We pay into
We
the
pay
town
in this town.
no, I understand that.
Okay.
But when I go to Anthem Blue Cross
Yeah.
and I say, I need coverage for 4 people, my rates are astronomical. When the town of Groton goes to Anthem and say, we have 500 people, those rates are more competitive.
Right.
So when you look at the bottom line, we pay more for insurance, health insurance for our employees.
You're covered under the town of Stonington's,
No, Groton,
you're under town of Groton,
Right.
why are you not under
We've audited
Stonington?
that program.
we're not allowed.
Because it's past that time? I think it was
We've asked numerous times. That all of this took place way before anybody in this building was set up. Mystic Fire Department is on the town of Groton's insurance. Quantic Bridge went to the town and said, can we get on yours? And they said, no. We went to the town and said, can we get on your insurance? We were told no. I don't know why.
Well, part of it is just the way we're self-funded and we want to get away from having other outside groups be in our insurance. That's kind of the general thought. You'd have to really look at what the increased costs and you have to make sure you passed it on. Differences.
I mean, there are big differences. I just want to make sure that everybody understands that when they call 911, regardless of the color of the ambulance, they are getting fully trained, competent people
Top-notch service.
to care for them.
Mhm.
Our workers' comp is a lot higher. I mean, it's all relative because when you do the amount of call volume, there's more chances of having an accident or pulling a muscle when you're lifting somebody or, I mean, it's the same as if you drive your car 100 miles or 1,000,000 miles, you have more chance of getting into an accident. But that being said, yes, we pay $1 for the rental of the building, but we do all the maintenance to the building, except for exterior maintenance. We'll discuss that at a different time. But, I mean, we still have expenses with the building. They have a mortgage. I wasn't around when they bought the building. I have no idea how they did that. I would love to buy my own building, but trying to find a building in Groton, yes, so.
I feel like there's a whole lot of apples and oranges being thrown up right now.
There are a lot of differences.
Yeah. And I think some of these things we can solve, some of them we cannot, at least today. Roscoe, Mayor, do you have any questions? Are we all okay with moving forward with this concept?
Absolutely.
Are you okay with us moving forward?
I would be,
He's my treasurer, so.
I'd be stupid to say no. I'm not in favor of.
You're comfortable with moving forward with this concept?
Yes.
Yes, I just want to make one note. There was mention of a possible agreement. You can't hamstring the RTM on budgets. So it'd be a policy with the council. It's not going to be, we guarantee you we'll fund this. You can't waive the authority of the RTM.
That's one of the things that I'm concerned about, the multi-year agreement on something with our business model. We've been discussing
volunteerism is down, continues to go down. Everything else in it, grandkids, kids, softball. And one of the things that we're seeing is that we are having staff more of our hours.
And that's an internal discussion.
It's an
That's pretty
internal,
much everywhere,
it's an
isn't
internal discussion, but the concern is
it?
future doesn't allow to do it.
Well, and I mean, just to be very transparent, we have one more year in our term.
You never think that you're gonna not get reelected.
We currently have one more year in our term. What happens in another year, we have no control over. So we would love to get this moving forward. Come up with a plan other than, sure, that's, what you
Sounds
got last year sounds good. Yeah, I mean, really, that's what has been happening, and we don't want to continue going in that direction. We want to actually make sure you guys are funded where you need to be, and this is something that the town needs.
Okay.
Okay, we're all good? We don't have to make any motions because this is where we're at.
Want to set another date for me?
Month good, or is that too far? You said 2 to 4 weeks, 2 to 6 weeks?
Sometime after Columbus Day.
When's Columbus?
14th is Columbus Day of October.
Do the 15th work or no?
I think it is
15th of October is Tuesday.
I am not available.
Second, I am not available.
We actually plan.
Do that like this. No, that is not gonna work.
Tuesday, October 8th at 4:30. That's before council meeting. With that?
on me.
I am not available. I'll be on a plane.
A private plane?
No,
You fly commercial?
I do.
Wow.
November,
I mean, I can change the budget if you want.
but November 4th is a Tuesday or a Monday at 4:30. 4:30 a bad time for people.
Mondays I'm working.
Okay. Again, we have a town.
Keep in mind, we're gonna be entering the budget season in the next couple of months, so you want to get something done in the next 2 months.
Trying to keep it to Tuesdays.
I don't have to. Wednesdays are really bad for me.
It's unavailable or Wednesdays.
Tuesday, Wednesdays. and Thursdays. October 29th.
Good with that.
Tuesday, October 29th, 4:30.
Are you good with that, Bob?
Yeah, I'm available.
4:30 a good time. Like I can make any time. I just try to keep it as early as possible.
Yeah,
So
that's great.
No, 4:30
people
works.
can go home and. All right.
Everybody agreed.
So- Just so everybody's clear, we're gonna plan to come back to you with solid figures. And you want our budgets at that time also?
I would love to see your
Nice.
budget.
Not your new, but.
No,
Oh,
your
okay.
current, last year.
Yeah, no, you don't have to have.
All right.
Yeah.
Last
Mild
year.
cardiac event, don't worry about
But we talked about,
it. Yeah, I don't know about that.
the budget, the number of runs, the number of transports, and the revenue. So that's what we can have, we at least can plug it in and see where we're at, see how close that is to kind of the numbers that we've been doing, obviously minus the funding, so that. We do.
I can't hear.
Anything else, Bob?
Not on my end. The work at this point is gonna be, getting the rest of the things we talked about as far as finalizing those numbers with you guys. And then, getting some more numbers from Todd to be able to do a model with them as well. So if that's, and then after that, I'll be ready.
John and I will put our heads together and I'll email it up to you.
Say that again, Todd. I couldn't hear you.
John and I will put our heads together and then we'll email it up to you.
Yeah, I'll send you a list of things from you and from QMC, and then we should be good.
If there's nothing else, I'll take a motion to adjourn. All in favor? Aye. Aye. All right, passes 3-0 to 0. Thank you so much. Thank you, everyone.
Great.
Thank you, Bob.
Thank you.
Thank you, Bob.
You're welcome. Good to meet everybody. Talk soon.
Good night.